Welcome back to Rooted in Impact, a United Way of Coastal and Western Connecticut podcast. I'm your host, Ashley Gaudiano. In this episode, we're diving deeper into one of the most important topics at the heart of our work, ALICE. Joining me today is Daniel Fitzmaurice from United Way of Connecticut to help unpack what ALICE means for families across our state. Before we get started, this episode is coming out on the 28th, and so I just want to make a quick plug for the fact that we are in election season in Connecticut. Only about a third of registered voters actually vote in municipal elections. So here's a nice reminder to folks. You will have time to early vote through November 2nd. You can check the Secretary of State website for your early voting location. And then on November 4th, polls are open 6 a.m. to 8 p.m. So make sure you do get out there and vote. And with that, Daniel, let's just dive right into what is ALICE as an acronym? Who is that in our community? Tell me a little bit about what that stands for.
Absolutely. Thanks, Ashley, and thanks for having me today. First of all, we do talk about ALICE, which is an acronym, but I'll, make sure we start by thinking about this as people. We're talking about people who live in our communities, their households who are essentially struggling to pay their bills because their wages and the cost of living are mismatched. And we'll go much deeper into that. But the project is a research initiative that's been around in Connecticut for more than a decade. And the acronym is really helping us unpack some of the stigmas and biases that we might bring into a conversation when we talk about, like, how much money do you make and how much do you pay in your bills, which is not something, Ashley, you and I typically just like chat about.
No, it's not a day-to-day conversation.
But I actually like to unpack the acronym backwards. So the E in ALICE stands for employed. And so it's really important to think about households who are struggling to make ends meet as working. They're working in part-time jobs. Sometimes they're working in the gig economy. Sometimes they're working in a full-time job. But to move over a little bit, the IC stands for income constrained. So despite working 30, 40, 50 hours a week, the types of jobs they're in do not pay enough to afford everything that it costs to live in their particular community. And that's not their fault. That's not about work ethic. That's about the job that's available to them, the job that they love doing. And then if you move over one more letter to the AL, that's asset limited. And so assets are kind of a funny word, but the most important asset that many families rely on every day that we don't think about if you have it is savings. So if you put the whole acronym together, asset limited, income constrained, employed, you could understand how a household in your community, perhaps the car breaks down, and so they don't have a savings account to lean on to make the repair. So they miss a few shifts at work while they're trying to figure that out. And so then their job is at risk or they lose their job. And then you see the domino effect moving from just that individual, into their deep part of their life, like their kids not being able to have food or not enough food or going to medical appointments. So it's a real important acronym to unpack and understand. But like I said at the beginning, it's really about real life experiences people have and the data to quantify just how many folks are experiencing this hardship every day in our communities.
Yeah, I love that framing because I think often we get either stuck on the data side, right? And we're thinking about this as a concept, right? It is an acronym with numbers beside it. And often we don't ever get around to who that is, right? I think one of the really unique things about ALICE as a concept and ALICE data is that it is so relatable, right? Mm-hmm. We all either have been there, our parents have been there, our neighbor is there, a friend. And so, when we think about, and we can talk a little bit about the difference between federal poverty level and ALICE, maybe federal poverty level, those who live below that threshold, that may be a little further removed for some people. But across Connecticut, right, you have ALICE in every community. And the numbers show you've got 15, 16% at minimum in every community, all the way up to, Bridgeport sits at 67% of households are ALICE. talk a little bit about that idea of both federal poverty level and why it's so important to look at the ALICE data versus federal poverty level. Let's maybe start there, because that's a nice distinction for us to consider.
Well, yeah, and I'll say one more thing on that too, which is to your point about the relatability. I mean, neither the federal poverty level or the ALICE threshold are permanent conditions. Every young person when they're starting out basically is living in an ALICE household. Almost so many seniors and retirees are as well, because they're on a fixed income. And so, it's really, we hear a lot of stories as well. If you have a divorce, you then suddenly become an ALICE household the minute you have a child, despite being able to pay your bills for all the years before that with, let's say, two incomes coming into your household. All of a sudden, the cost of childcare absolutely blows a hole in your budget,
right,
and your ALICE
takes everything out of your control in so many ways, absolutely. Right? And seniors are really growing. That population has had a huge surge in the ALICE rate. And so too have single female-headed households, right? Two populations that are really on the far end of ALICE data, and something we have to think about when we're talking about services and supports.
Yes. Well, so here's the data then on sort of how it all kind of comes together in Connecticut, right? So, I mean, putting it all together, all the families or the households in our state, I usually say those things interchangeably. There are 580,000 families living under the ALICE threshold in our state. So one thing, by putting, the poverty line data and the ALICE data together, you really start to see the scope of the issue. That's 2 out of every 5 households who are struggling to make ends meet. And again, a lot of the same challenges they face are similar, regardless of what part of the spectrum you're falling in. But just so you understand how that data comes about, and to your question about, what are we really talking about between the distance of the kind of federal poverty level, which has been standardized, versus the ALICE threshold, which is something we're, been promoting and pushing for more than a decade. So just for some context, if you're a single adult, if you remember, we talked about that phase in your life, perhaps you're one adult in your household, the federal poverty level suggests you'd be making $16,000 a year and be able
to say that one more time, Daniel, for people.
Yeah, it's only $16,000 a year to make ends meet. So I don't know where in the state of Connecticut you could make $16,000 a year and afford to house yourself, feed yourself, pay for your transit and healthcare. The ALICE threshold brings it up, so you think about it as needing $38,000 a year to afford those basics. And again, that number is not just imagined, which unfortunately is the case for the federal poverty level, which is not really based on the cost of actually the items you need to buy in the state of Connecticut. The federal poverty level is standardized across the country.
Right. Whether you're in Iowa or Connecticut, a single adult is $16,000. Yep. Doesn't matter where you live.
But the ALICE threshold is really about what would that single adult need to buy those basic items. And they do calculate them based on national data sources. So it's very authoritative. It's very conservative, housing, food, transit, healthcare, childcare. As we get there, we should talk about a family with children, because I think that's, like I mentioned, so often the experience that families go through where their financial hardship really creeps up on them. It jumps in at you. But so the federal poverty level for a household with 2 adults and 2 young children is $32,000 a year. So again, that's a very low amount to be able to afford anything. But again, that's the cutoff for that family for many federal programs and even some state programs, what we call, I guess, safety net programs that really help families try to make ends meet despite, how low income they might be. Sometimes it's a multiple of the federal poverty level. But again, when we hear right now about what's going on with reductions in food assistance, for example, or challenges in getting affordable housing in our state, the federal poverty level is a metric that matters, but it doesn't capture the extent of the hardship.
Yeah.
So for a family of 4, just to pull it up, so we have it. So 32,000 is the federal poverty level, but 116,000 is the latest ALICE threshold. So that's a multiple of the federal poverty level. That's quite significant. And even once you start to pack into that budget, um, you would see how challenging it would be if you were a family with two working adults and two kids to actually afford enough housing, food, and childcare to really do it. So we look at the data and the numbers sometimes in a group setting. You and I have done this many times, Ashley, and people are typically shocked to see how difficult it would be, for example, in the case of this family of four, to find adequate housing for $18.50 a month, including utilities. I mean, it's
Right.
nearly impossible. So really, when we talk about two out of every five households, I mean, that's at least two out of every five households who are
Yeah,
living.
it's a conservative estimate, I think. And I think your point is really valid. When we say that number, the first reaction is that's a lot of money, right? When you say 116,000, people go, "Oh, that's a lot." And then you start to break down what the actual costs are and what's allocated to make up that 116,000. And it doesn't, right? They don't add up. The other thing I'd like to flag for people that is missing from that ALICE budget are your youth sports activities, your child's band or music experience. We live in pay-to-play towns in many cases, and those things are missing. You're missing clothing in some cases. How quickly, especially again with kids, how quickly do kids go through clothing? You're also missing savings, right? So to your original point when we started, you're missing the ability to contribute money on a monthly basis to any sort of savings account or debt payments. And so households are either incurring and racking up debt in order to live, or they're not able to save so that when that emergency happens, there is no buffer for the high healthcare bill. There's no buffer for the car that breaks down or the refrigerator. And so those are all nuances that aren't factored into it, but it certainly gets us closer to where we need to be to talk about the actual cost of living in our state and the solutions that need to come to address those things.
Yeah, and you know what? It doesn't take into account either, actually. Sorry to make it worse. This data, because it takes a while to calculate, is from
Yep.
2023. And as I think we've been hinting at, but just to say it outright, our sense, and the data supports this, is that the mismatch between prices and wages is because of the prices. The
Mm-hmm.
prices are going up faster than wages by a significant amount. And we've been watching that since 2019. There's been a huge spike in prices since 2019, and wages have been growing, but not nearly at the same amount. And then since 2003, we really wanted to start thinking about another factor that's making prices go up, which is tariffs.
I was
So
going to ask you if you had some data on that, Daniel.
oh yeah, well, when I see the budget, and I think of a family who has to account for every penny of their salary every single month, right? You mentioned it. There's nothing at the end, right? It's just every dollar in is going out to support their family. And, you know, when you then see on average that households in Connecticut have paid an additional $2,400 due to tariffs, that family is finding those dollars don't go as far. And that's a real critical issue. It's not just, oh, I'll just find another way. That just means they're putting it on the credit card if they need to put their groceries on the credit card. That means they're skipping medical appointments. That could mean that they're working another 10 or 15 hours a week, or taking on a part-time job in addition to their full-time job, which we hear about quite a lot, to try to make sure that they have enough money every month. And again, this is the sacrifices that families make of their own time with their kids. I remember at the event where we announced all this new information, one of the families who spoke mentioned that she knew exactly how many overtime shifts she had to work to
Yep.
afford summer camp.
Yeah.
But there's no choice, right? You actually have to work those extra hours, because if you don't send your kids to summer camp, you can't work. And so you see how this vicious cycle really takes hold over and over and over again.
Yeah, it is one impossible choice after another is what we often say. I'm going to pause us for a second, Daniel. Let's just hit pause. my wonderful team who does this podcast would like to share a story about a family who leveraged one of our programs, the Alice Fund, which is a rapid response financial assistance program, meaning people can come to us, they can be in a crisis situation, not able to pay for that car repair, and we actually have cash that we're able to provide them to fill those holes. And so we've got a great story. So we're going to hit pause and they're going to share one of those stories and then we'll be right back.
Not long ago, a single mom here in our community, we will call her Mary, was working full-time and doing everything right. But when her car broke down, she suddenly couldn't get to work or drop her kids off at childcare. That one unexpected expense threatened everything. That's where the Alice Fund stepped in. Through United Way Coastal and Western Connecticut, Mary received emergency financial help to cover the repairs. Within days, she was back on the road, back to work, and back to stability. There are hundreds of stories like hers, and with your help, there can be hundreds more. You can make a difference by donating or becoming a sponsor of the Alice Fund. Visit unitedwaycwc.org to learn more and see how your support can change lives right here in our community.
All right, glad to be back. What I think people can take away from this first section is that Alice, right, both isn't just a number, it is real people. But from a data perspective, it's also a framework that every sector can really use, right? And so I know we have people listening from different sectors, but if you're a business, a corporation, right, you can think about wages that you offer, benefits, paid leave, flexible work environments to help families who are Alice, and given all that you just learned. For government, right, think about policy decisions. You can think about things like, how does your social service department in your town provide response and funding, and what are they using as that top end income measurement? And then I think for nonprofits, right, it helps ensure that our programming is really meeting people where they are financially. And again, are we including programs and policies that are expansive enough to capture this population that is 40% of our state? So I guess, Daniel, from your perspective, what do you see, how do you see people using the Alice data in different sectors? Any good examples there? And then really, what do you think is the biggest opportunity for using Alice data to shape the systems, right? Which is so much of the work that you and I do. How do you use this to shape the systems and the sectors that we are working in and with, business, philanthropy, government?
That's great. So first, every time I give this presentation, you probably have this experience too, Ashley, even though, we talk about, we say it, there's an Alice family in every community, right? 2 out of every 5 on average. There's still people who say, yeah, just not in my town, though.
Not in my town. Or only in that one housing complex, right? That's what I got the other day was, well, but only because that type of housing exists. The data is the data.
The data is the data. So we use these maps all the time, which you can see on our website, that we really do show people precisely how many households in their town are living paycheck to paycheck, living under the Alice threshold. And yes, many of our urban areas have a very high rate of Alice households. Like you mentioned, Bridgeport at 67%, Danbury's at 55% right now. That's factual. But what we really did this year, which because of the price issue that we've been tracking over since 2019, we really wanted to see, since 2019, there were 80,000 additional households that became Alice households. And we wanted to know where they lived. And again, thanks to the data, that's not hard to do. We could see, where has the share of Alice households in various towns gone up and where has it stayed the same? And so, as I mentioned, with Bridgeport, which is a very high rate, it hasn't changed since 2019.
It's that pretty steady, fluctuating a point or two.
Yeah. Same thing in Danbury. It's not statistically greatly different than 2019, But when you peel it back, we were very surprised to see there's this little pocket in your area of New Milford, Washington, Roxbury, where hardship has gone up. Like New Milford was 26% Alice households in 2019 and is now 44% Alice
Yeah,
households.
15+% jump in that southern Litchfield County area. And, I guess, Daniel, I have reasons why I think that's happened. What do you see as maybe the top 2 or 3 reasons that that's happening?
That's a great question.
Any guesses?
I've heard different variations. I would just emphasize that, again, the way the data is calculated, the wages in certain communities have remained very stagnant. In fact, much of Fairfield County over this stretch of time has remained steady from an Alice perspective. So wages and prices are tied closer together. But as you go more to our suburban and rural places, the jobs people are working, the wages are not going up as fast, and the prices of things are just continuing to go up, right? So everyone is subject to the same level of price increases, let's say for food and let's say for housing.
Yes.
But the wage you're earning is not growing as rapidly. That's my best sense on these things. And again, one of the challenges, which, is important to think about from whether it's a personal or a structural thing that we can do, is that many of our suburban and rural communities are not equipped to help families who are experiencing financial hardship because they've typically experienced great stability in their financial picture. So again, I don't know with great specificity about each of the towns when we look at this area across the state where there's been hardship, but I live in a suburban town where we do not provide the same level of social services that you could get in the city that's a few towns over, really actually one town over. So I think that's something we should think about. And it's something that at a personal level you could do, right? Where are you volunteering your time, giving your dollars? There are community organizations in our suburban and rural places, but they're not typically as well resourced as the ones that are in our urban centers. And you could help with that in many, many ways. We definitely, at the state level, when we all work together, all the United Ways across the state, it's why we propose policy solutions that are somewhat geographically not specific, right? It doesn't matter where you live. When we are at the Capitol advocating for a significant increase in investment or stronger investment in 211, that's because anybody could call 211 or access 211 online, no matter where they're living. That's why this Connecticut Child Tax Credit is so important to us, because it's not specific to what you would get in New Milford versus what you'd get in Bridgeport. It is actually a solution that lifts everybody up regardless of where you live. And so that's sort of tends to be where we go on the state level. But of course, anything in that Alice budget that could be made either more available or more affordable to somebody, again, the housing, childcare, food being the biggest ones, is obviously going to help lift those families and those communities into getting ahead over time.
Yeah, that's all really good. I would add a few things there. So I think when we look at that New Milford, Washington, Roxbury area, right, we, especially during COVID, saw this huge influx of individuals from New York into the Fairfield County area. And I think the reality is that pushed people further into our state. As prices have gone up, people are looking for affordable places to raise their family. And I think some of those southern Litchfield County communities had some of that. I would agree entirely that, when you talk to folks in New Milford who, by the way, New Milford does a fantastic job with their social service program.
Good.
However, they're not equipped from a nonprofit standpoint and from a state resource standpoint to serve families in the way that they need. And so families are going to Danbury to seek services, right? A neighboring town. But what do you have from a problem there? You've got transportation challenges, right? Where do the bus lines run? You've got time and hours because these are working families. And so, again, how do we look at where people are moving, where those numbers are increasing, and make sure that we're allocating resources, public, private, you name it, to the communities where the need is getting greater, and making sure that we're creating a level of responsiveness and, a real link for folks to understand who they're serving, what they need, and how to get it to them. And then I couldn't agree more on, everybody can do something, right? The Alice household budget is really simple and straightforward. And if you want to start to address it, you need to plug in to those line items into housing, into utilities, childcare, food, healthcare. And so, we've got a food pantry in my suburban community that's situated within social services that needs volunteers all the time. We can do a lot of work to reduce stigma around receiving social services and having people access nonprofit supports, because it's often us as nonprofits who are able to provide supports outside of those federal poverty level multipliers. So I think there's a lot that can be done. And I would really urge individuals to think about how they play a role, but also our private sector and our corporate partners to think about how they play a role with their own employees, because there's huge opportunity there. They're often the touch point on a day-to-day basis for people. And so what supports can they put in place, or who can they bring in, right? United Way partnerships as an example, who can they bring in to help them think through real solutions that they can incorporate into their own workplace?
I gave a presentation to a business group a couple of weeks ago, and the initial impetus to do it was like, we know our industry doesn't pay enough.
Yep. That
was their initial framing. And the more we spoke in that planning to do it and in the moment of giving the presentation, I really tried to emphasize, like, it's a very complicated issue that has ripple effects. So yes, there's something you could do in that regard, but part of it is also understanding that your employees rely on, the bus driver to get their kids to and from school every day. And they rely on a nursing assistant to take care of their elderly relatives. And so we all are connected in this way. So, again, you mentioned about like the stigma, like some of it is, that level of awareness you could bring to your workplace so that you could make incremental changes. I mean, those little changes do have significant impacts over time. And even just bringing that awareness, like the presentation I was giving to the employers about the issue, I hope, added to that empathy building that you just have to have in order to, I think, be effective in this economy, right? This is the economy we have right now, and we can help move it towards something that's more prosperous for everyone. But you really have to kind of grapple with it in a more complex way than just, oh, I wish we could pay everybody more. Yeah, that is true, and that would work. But there's actually some other ways we could move towards that direction as well. It's not just your employer, it's the whole ecosystem of work and the economy we're in.
Absolutely. And you wrapped us up so nicely there, Daniel. If people want more information on Alice, they can go to our website, they can go to United Way of Connecticut's website, and they can also go to United for Alice, which is kind of the national the source for all of this data. Thank you for joining us and for giving us some of your time. Thank you to listeners for tuning in. We're really, really grateful that people are taking the time to learn about and think about their neighbors and the people that they live and work alongside day to day. And I hope that people take a little bit away from this, but as always, you can reach out to either Daniel or myself to do some follow-up on this and figure out what your own action step can be. So thank you, Daniel. Have a great day. And we will see everybody soon. At United Way of Coastal and Western Connecticut, we work side by side with our community to address critical needs and advance equitable pathways to well-being and financial security for everyone. Rooted in Impact is a podcast that highlights how we are making a difference in our communities. Thank you so much for listening. If you want to learn more about us, visit unitedwaycwc.org. And if you're interested in being our podcast sponsor, we'd love to have you. You can find new episodes every other Tuesday wherever you get your podcasts, including Spotify and Apple Podcasts.